and welcome to the Posit Podcast. I'm Dr. Sam, and with me is Dr. Robert. How are you, Dr. Robert?
Well, I'm doing great. Just getting over a cold, so I'm the better end of it, which is great. How are you doing?
I'm doing great after all of our travel, but we have a guest here today that I'm so excited about. So Blake Dube from Pawprint Oxygen, you're the co-founder and CEO, and I love having guests. It's like my favorite thing. So I'm really happy to have you here. We're both really excited that you came to join us. Um, Tell us a little bit about yourself.
Yeah, thank you so much for having me. I'm the founder of Pawprint Oxygen, and we make oxygen accessible to pets, pet owners, and veterinarians. So really how we got started on that initially was we met a local veterinarian when me and my co-founder were in college, and she had no way to transport oxygen-dependent pets. I'm sure you guys have experienced this maybe when you're at primary care and you need to get the pet out to the ER, right?
Absolutely.
Well, I'm primary care and he's ER, so it's getting them from me
Perfect.
to Robert. And
Yep,
yes,
exactly.
we've definitely experienced that for sure. We've had those animals that you're just going to be there. I had one Frenchie. I think we were there until 11 o'clock at night because we just couldn't extubate him, and there were no other options. And unless he was going to walk out, we were just going to sit with him until he could breathe on his own again.
Exactly. And if that was you in, a human hospital and you need to be referred, they'd call an ambulance, right? And you would get oxygen on the way. And unfortunately, that's just not really an option in most places right now. So, a lot of these pets just don't have a place to go. They can't go home. They can't make it to the ER. And unfortunately, that means a lot of expensive care or even euthanasia sometimes. Yeah. So we made this product specifically to get pets from A to B. That's how we started. Right here in Pittsburgh. And it really opened our eyes to, oxygen is used in so many different places. It's indicated for so many conditions, but it's just inaccessible because of those big, heavy, high pressure tanks, right? And that's what makes it dangerous. So what we did is we packaged the oxygen in a really low pressure, safe, and portable way. So it really fits in the palm of your hand. It kind of feels like a can of sunscreen or a can of hairspray.
Cool.
And because of that, it's really lightweight and safe and easy to use. So pet owners can use this not only just getting to the next facility, but they're using it home for tons of different conditions, whether it's a heart failure, a collapsed trachea, or something like that.
Wow.
It's really helpful just because I know the number of just getting transporting patients, but we have calls from RDMs or primary veterinarians all the time saying, hey, we can't get them there because they can't breathe. And having something that's that small. And I don't think people realize how heavy those oxygen tanks are. Some of them are about almost as tall as I am, and they're all steel.
Yep.
They're just massive tanks. So they're very expensive and not expensive, but they're heavy. So they're not fun to deal with.
Yeah, and they scare people, right? It gives this idea that, oxygen is dangerous. And really, it's not. It's just the pressure at which it is held. So we just made it, a lot smaller and lower pressure because a lot of these pets, the ones that tend to run into these issues, they tend to be smaller.
Frenchies,
smaller
bulldogs.
lungs. Yeah.
The small little fluffy guys with heart disease.
Could you guys guess the most common breed that we service? Now, we help all kinds of breeds, but the one that's the most common.
I would have guessed French bulldogs. That would have been my guess.
I would have
that
Chihuahua.
A lot. That's actually... Okay, Chihuahua. There we go. You're right.
Chihuahua? Why?
Because there's so many Chihuahuas out there, right? And we help them with a lot of different stuff. But like I said, it's just this could be used at home. It makes the pet owner feel comfortable knowing they have something to really save their pet, whether they're managing their crisis at home, kind of like you would with an inhaler, or just getting them back to that professional care. We started that way, and then we started to realize that, sometimes there's pets that even need longer term oxygen, where they're in that oxygen chamber or something like that at the vet hospital, and there's just no way to get them out of that, right? Again, you would take oxygen home, you would have a nasal cannula in, it would be relatively inexpensive, but pets don't have that option until we came along. And so now veterinarians can actually write a prescription where we set them up with a veterinary grade oxygen cage and a generator in their home. And it's this really safe, managed way for them to give this longer term oxygen without spending weeks in the hospital.
That's amazing, honestly, from my standpoint, because I know in ER we have a lot of patients that have like pulmonary hypertension or they've got, congestive heart failure. They're doing fine in oxygen. They're happy. They're wagging their tail. Their parents are like, why can't I take them home? Because we open the door and all of a sudden they can't breathe. And we're like, that's why I can't take them home. So they close the door again. And it's tough for the owners because they're eating, they're drinking, they're otherwise 100% normal in there. But they're spending upwards of $1,500 to $2,000 a day just to watch their pet in this little incubator. And it's tough and it's very expensive. And I love that this is like an alternative solution because it can literally save owners so much money. And yeah, I love it.
Yeah. And oh, go ahead.
Oh no, I'm just curious about, so you set up, because that was the oxygen delivery. Like I get the tank, but is it much like the same way it's set up at the vet clinic where you have the large canister and all that stuff?
Great question. So we don't deal with the high pressure like cylinder tanks at all. So what we do for those big for those chambers that you would need to fill up with oxygen is we use an oxygen concentrator. And that's very similar to like, if grandma needs oxygen, for instance, and she's sitting at home nowadays, she wouldn't have a tank. She would typically have a little generator that kind of looks like an air purifier, right? You turn it on and it constantly generates oxygen just by taking in room air. And it's really nice. So these have come a long way. They're really safe. They're not holding that oxygen at pressure. And we can rent these units and they look like a little, like almost like a carry-on suitcase size. And they're so easy. I mean, you just plug them in, turn them on, and they'll fill up your oxygen cage. So we can do this safely. So we're trying to make it so you never need to worry about that oxygen tank running out or tipping over. It's just, you have this nice unit in your house where, when you're done with it, you send it right back to us.
And will you send it anywhere? Like, is it just local to Pittsburgh? Or, I mean, this sounds like something that everybody should have access to.
Exactly. So we ship it everywhere. So we can do overnight delivery. So this is actually something we work with vets on a lot because your guys' input on the pet's care is really important here, right? Just because they're on oxygen doesn't mean that's the only thing they're on, right? And they might need that 24/7 care. But as Robert said, when it is right, and they are eating, drinking, maybe just getting a few fluids and they're ready to go, that's where typically vets will call us or write us a prescription and we can get it there as soon as next day. And there, we're doing all the work of walking the pet owner through, because it's a stressful time, right? Taking your pet home from the hospital. And as vets, you're very busy, right? So we kind of take that over and hold their hand through this process. And it's been really nice to kind of get to know these pet owners and see the value we're providing them by letting them bring their pet home and get better.
Wow. Do you find that you have more people that are coming for the cage aspect of things, or the portable oxygen sort of like acute intervention sort of thing? Where do you find that you're getting more traction?
Yeah, great question. So I think a lot of people immediately think they need the oxygen cage and the concentrator, the bigger system, because that's what you're used to seeing, right? That's what your pet is on in the ER. But luckily for us, pets don't get as much kind of chronic respiratory disease as humans. So humans get, COPD, where you need oxygen kind of constantly. Pets can get that, but it's less common. A lot of these conditions, they really just need a little bit of oxygen to get over these episodes and get back to normal. Because as you know, some of these pets have a tough time regulating themselves. So most of the time we are selling a lot more of our portable oxygen kits. So even if they come looking for one product, we're steering them in the direction that we know is right based on the veterinary advice. And so it could be a pet with a collapsed trachea who's using our kit for 5 minutes a day, administered through a pet oxygen mask to kind of get them out of that cycle and get them back to normal. So we do that for a lot of conditions, from, laryngeal paralysis, even feline asthma. We work with a lot of cats. So yeah, we find that the oxygen kits are probably more broadly applicable to a lot of these conditions.
Yeah, I once had a Frenchie owner who had experienced like basically acute respiratory distress in one of her other dogs, and so that was she was like, I need some sort of way to get, if this happens to, because she had like 4 Frenchies, so she's like, well, it's inevitable, it's gonna happen to one of the other ones. Yeah, that's why I thought it was Frenchie. That she wanted to have that on hand. And Gosh, I'm going to go back in that record now and see if it was you all that she found. And I didn't realize everything that you guys have to do, because I mean, that she did. That's what she was looking for. And she needed a prescription and everything. So,
Yep.
yeah.
Yeah. And that's been a really nice way for us to really communicate with the vets. And because a lot of times this is new for veterinarians too, right? You guys are used to seeing the big tanks. So then we get the chance to kind of educate you guys and show you, what's new in oxygen. And a lot of times that means a vet is, buying our kits, having them in their hospital ready to transfer.
Oh, yeah.
But it's sometimes you guys are for even more than that. In fact, we started just with this idea of transport, right? Let's transport from primary care to ER. And it was vets like you that were coming back to us saying, hey, I use this in radiology when a cat goes dysmic, or I use this on dog walks or triage or comfort room. So it was the vets finding new use cases for this that's really opened us up beyond just, oxygen is needed in transport.
Can I ask with the canister, so like the smaller one, how long does it last for?
Yeah, so it depends on the pet size. So basically we have, different flow rates based on the pet's weight, but it'll go up to 30 minutes per canister. And typically we're giving them a kit that lasts around 90 minutes. So what's nice is, that's typically enough for a transfer, generally, but then we'll have pets that get it for home use, where it might be a laryngeal paralysis case, for example. We found that about 5 minutes of oxygen at the onset of an episode is enough to bring them out of it. Whereas you might be used to these pets presenting after having cycled for 2 to 3 hours, and now they're in such bad shape they need a night in the oxygen cage. So we actually just did a big study with our customers from the last 2 to 3 years, and we found that for some of those conditions, it takes a surprisingly small amount of oxygen through that face mask to just kind of reset them and bring them back to normal.
Wow. I guess that was my question. What's the delivery system? Is it like a mask that you kind of have to train them to? What does it look like?
Yeah. So I didn't really visualize it for you guys really well. And usually I have it right next to me. So so it's kind of like this almost like hairspray size bottle that is so light you couldn't even tell if it was empty, right? It's very very lightweight because it's just oxygen. And then that connects to a very easy to use like little regulator. So you just twist it in and turn it on. It's one fell swoop. And then the oxygen is in and it's working, right? It's coming out. And it's administered through this pet oxygen mask, right? This tubing that goes to one of our specific pet oxygen masks. It's called the PureVet pet oxygen mask. And typically what we find is we don't really have a lot of issues with compliance with the pets accepting the mask. And there's a few reasons for that. So one, being with the pet owner at home, they're typically a little less stressed out. The mask has a lot of visibility through it, so the pet can kind of see what's going on. And then what we found is if you're masking a pet that truly needs oxygen, they typically feel that something is helping them after a little bit, and they continue to breathe. Whereas if you mask your, totally fine pet who's just panting normally, they're probably not going to want to have anything to do with it, right? So we have a few tips and tricks we show to these pet owners. It's actually a little different from maybe the anesthesia masks you guys are used to with that rubber gasket and things like that.
Yeah.
It's a lot different, so it's a lot more comfortable for these pets to use.
Does the oxygen have any sort of an odor? I know that's an odd question, but I feel like sometimes that's what they kind of have a problem with their bigger machines. So I'm just curious if these have any sort of odor. Not that a person can smell, but the dog could smell.
Yeah, so oxygen shouldn't, unless it's coming from like sometimes those big machines, right? Might smell like they've been working a little hard or something like that. So from the canisters, that's not an issue, and that's also why the mask is really important, because they don't want to smell this rubbery, cheap plastic smell, right? They want to smell nothing, ideally, or we'll scrape a little peanut butter in them for a pet who's especially difficult. So we do a lot of treat training, is what we suggest, where hey, if you pull this mask out right when you get it and you pretend to use it and you show it to your pet, they understand that, this is something I'm familiar with, I'm okay with, is safe, instead of just waiting to open this kit at the first sign of like an emergency, right? You get it out, you get you and your pet familiar with it and things like that. So it's all these tips we've learned over the past couple of years working with these. I think it's been like 6,000 pet owners now have been prescribed these kits.
Oh, wow.
That's
Yeah.
awesome. And I think honestly, the stress thing is a really big deal because the number of pets that get worse as soon as they're in the hospital, it like magnifies exponentially. It's like they get in here, all the stuff is going on. They're breathing that wasn't maybe like, 30 breaths per minute at like 60 all of a sudden. And any condition they have is that much worse. So being able to do it at home is really kind of a luxury. Not that they should replace care, but if it's something that you can prevent it from happening in the first place, it's really, really pretty cool. I love that. Makes my job easy.
And that's where you make a good point. That's where your like advice as a vet is so important here, because if a congestive heart failure case is being prescribed our oxygen kits, that's great. That's going to help them stay alive on the way back to you. But it's not going to mean that their episode is going to end, right? That once those things decomp, they need to get right back to you. Whereas, the collapsed trachea, the asthma, the dynamic obstructions, we can actually stop them before they become an ER visit. So, there's so many different reasons a pet might need oxygen. And that's why we've always kind of gone through our vets to introduce this to the pets, get them comfortable with it. And we really hope it's becoming a standard of care now for some of these conditions.
Do you find any vet clinics kind of wanting to keep that? So the way that you describe the oxygen cage, just because, it's expensive for you to have the big canister. And I mean, that's how we deliver oxygen during, anesthesia or things like that. But those are short period of time. And we don't even have like an oxygen tank for like long periods of time. We usually just end up, oxygenating them as needed and then trying to get them out the door, like you mentioned. Just because I'm not an ER, I'm just a general practice. And I like the sound of just like how you're using that, so that you're not dependent on this canister. You kind of always have this perpetual ability. As long as there's room air, you can always make more oxygen. Am I understanding that correctly?
You're exactly right. And we're selling, we're working with a lot more vets on that, because they found that they're either dependent on one canister or just their anesthesia system, which nowadays you might always be using that anesthesia system for actual surgeries and dental and things like that. So you can't bring that pet out from the radiology table just to give them oxygen, right? Mm-hmm. So we do a lot of that, where we actually sell the cage, the chamber, oxygen chamber we sell is a veterinary grade chamber. So it was actually originally designed for vets. And so we have a lot of veterinarians just kind of get that in their clinic. And it's something that's super easy. It folds up and folds down. So you stow it away when you don't need it. You pop it right up when you're ready. And then you turn on the oxygen cage. So yeah, we sell a lot to veterinarians as well.
So there is the option to kind of own this thing versus just renting it, or do they just rent it from you forever?
No, the veterinarians typically purchase our equipment, and we have more, even more like kind of like industrial grade things for them to set up. Because I think that the tanks are kind of going out of style, right? They're more going into these oxygen generators where you set it and forget it, and things like that. But pet owners typically, ideally, no pet really needs to live in oxygen, right? It might be a pneumonia case where they just need it for a few more weeks, or even palliative care. Some of our most, I think, meaningful work has been with, a pet owner who their family needs another week, right? They're not ready to make that decision on a Tuesday at 2 a.m., right? When this event happens. So we help them get a little more comfortable, and it really can save the relationship with the vet a lot too, because you guys are both between a rock and a hard place there. So we help you out of that. And then, you want to return the equipment, right? You don't need that anymore. So, that's kind of how we work with each.
It's great that they have that option, especially what you said, I think is really true. Euthanasia, it's so important how you help a dog at the end of their life, or cat at the end of their life. And I think one of the worst ways to die, truthfully, is to suffocate to death. And so generally, I will tell people, like, that's a hard line, And there are people, and I've definitely come up against those people that are like, well, I would rather euthanize them here, even if I'm not ready. And I wish I had more time, or like you said, I could bring them home and they could say goodbye to the family or whatever it is. But I don't want to go to the emergency clinic where they're strangers. My dog or cat is not comfortable there. And no offense, Robert, but sometimes they really they'll do anything to be able to like get them a couple more days to get them to me, who's known them their entire life, so that I can be the one to euthanize them. And you know what I mean? And I never,
Exactly.
I didn't realize like that was even an option, honestly.
Yeah, no, exactly. And a lot of times that's kind of the first thing that maybe vets or people think of us for is, like that use case, which is definitely part of it. And sometimes there's a pet that's not right for it, right? And the quality of life can't be maintained just through oxygen. But a lot of times, that those couple days can mean the world as far as that relationship, just with the family alone. So that I think is a really important thing. A lot of our oxygen kits are more kind of like preemptive right before that, because you have a pet with a collapsed trachea that could live for, years and years with a great quality of life. But you come home one day in the summer and you get too excited and it's hot out, and, that could spell trouble. But even then, we've had some kits just for a pet that is near the end, it helped them get back to the vet for a dignified euthanasia, because, one of the worst ways to go is in the car. And that's really, the car on the way has been really sad. So we've had pet owners just reach out saying, hey, it was his time, but you helped us get there, and give him kind of this dignified passing. And, that means the world to them as well. So
I think that's awesome, man. That's, 'cause we see that all the time. And just even like over the holidays, I think I had 2 patients that, unfortunately, the other side of the line that Sam was talking about was like, we don't believe in euthanasia, and their pets were having a hard time breathing. And usually I agree on it. That's a hard line. I'm like, I don't usually let you go home, but I can't force people to stay. And they'll give me the option to go home with something like, hey, I know the rest of your family's coming home this week. They want to make it to see the family. I get that. Or go back to their primary vet for the euthanasia. That's a really big deal. So I'm going to tell my clinic about it when I get off this podcast.
Yeah, I know. I'm curious about, so I think what people might want to know too is like the sizes, you know what I mean? Because some people have Great Danes. So what do they do?
Exactly. So the kits come in kind of like, color coded sizes, if you will, just kind of like how you would buy your flea and tick and things like that. And really it's the same oxygen, right? It's just a different mask size for your pet, and then a different flow rate for, different pets, because, Great Dane's going to need a lot more oxygen for those big lungs than a tiny little Chihuahua. So the kits, they're pretty self-explanatory. For the oxygen cages, we can fit up to a 70-pound pet typically. So we have 3 different size cages, and the biggest one is up for a 70-pound pet. And right now, if your pet is over that, typically it's more of either a nasal line or kind of masking.
Wow. So do you have that as well? Do you have nasal cannulas? I guess that would be,
Yeah, exactly. And it's more kind of like what you guys would use like a red rubber catheter for. And it's typically, if it's longer term, it'll be stitched in. But the way we kind of see is, any pet, of course, can need oxygen due to like a trauma or something like that. But the most common conditions are, a lot of pets under 30 pounds with these conditions I keep bringing up: the heart failure, the collapsed trachea, the LARPAR, a lot of pneumonia as well. But I'd say so much pneumonia this year that I'd say some of it is misdiagnosed possibly, and it might be that mystery respiratory disease I heard you guys talk about.
Yeah. Although that can lead to pneumonia, so
yes, exactly. So we've done some work with that. I'm not spreading alarm bells by any measure. It hasn't been super prevalent or anything like that. But a lot of these different conditions are, more for that oxygen kit style rather than that big oxygen cage.
Yeah. And Robert, especially seeing trauma like you do, like a pulmonary contusion, I mean, there's nothing you can do but just give them time on oxygen, right?
Exactly.
I mean, that's it.
Yeah, just give them time on oxygen. They usually do great. They just need some time. And I guess I'm curious, for the oxygen concentrator, what's the level of concentration it gets up to? Is it up to like 60% oxygen?
So they're really good nowadays. They go up to 96% oxygen, which, that's really far.
Oxygen's for our buck, yes, but that's impressive.
No, these things are, I mean, I always say like these are things that like, because they were designed for people with respiratory disease, they are designed so well. and they have to work, right? Someone has to rely on them 24/7, 365, because some of these people need oxygen like 10 liters a minute for, the rest of their lives. So it's certainly not too tall of an order to use something like this for, a couple hours a day for your pet or something like that.
So is there any way people are able to check their saturation, or is there do you have like pulse ox that you're pairing or anything like that?
Another very interesting question, because pulse ox is always such an interesting thing. So pulse ox is a really not a good way to measure oxygen in a pet, because it's so hard to do.
Yeah.
And typically, a lot of pets can look like they have a great pulse ox, and somehow they're still in respiratory distress, right?
Mm-hmm.
So we do a lot of education behind really showing pet owners the signs of respiratory distress, knowing what's normal for their pet, and then knowing what's not normal, the abdominal recruitment of breathing, right? Breathing with the belly, blue tongue, certainly. But to your original question, the way our cage works is it's actually pretty cool how it sets the oxygen level, because as a vet, you can prescribe a certain oxygen level from 0 to about 60%.
Huh.
Yeah.
And the reason we do that is because typically, if you put a pet at over 60%, they're actually at risk of hyperoxia or oxygen toxicity.
Mm-hmm.
So we find that a lot of vets in the hospital kind of start at that 40% marker. And there's these Venturi fittings on the side of the cage. And basically what they do is they're going to draw in a certain amount of room air, however much they need to hit that oxygen percentage. And what's really cool about that is by giving them even more room air to cycle through that cage, that's what's dealing with the heat, the humidity, and the carbon dioxide that is so important to monitor.
Yeah. That was like literally my next question. I'd be like, so how exactly are you dealing with the
exactly. So
well, there you go.
how a $30,000 veterinary oxygen cage work, where you change out all those beads every like 30 minutes is, they have all these sensors for managing heat, and, you need to change out those CO2 beads every half hour or something like that. How we do it to make this affordable for pet owners is we use this Venturi system that's basically going to just force enough air through that system. Think of it almost like a fan in your cage. That is dilute. So it's putting a lot of 40% oxygen in there. So instead of just trickling in a little bit of high purity oxygen to eventually get that cage up, you're immediately sending a lot of this 40% mixture in, and it's enough to make sure you're diluting the CO2 that your pet is breathing out, because you can't just put your pet in a box, right?
No.
And that's where everyone goes wrong trying to do it at home. It's so dangerous to do, and you shouldn't.
Yeah.
I agree 100%, because every owner that I've talked to is like, well, I can't take my dog home, just buy an oxygen cage. I'm like, there's so much that goes into an oxygen cage, like the humidity, the CO2 exchange, like all of that. And I think it's great that you guys solve a lot of those things, because it's good to give vets a resource now to be able to send them home, because I didn't really know go to them before this, to be honest with you. So it's great.
Well, and I think too, just in the whole, because of how complex it can be, it is almost like for like GP, where we don't see enough sort of reason where we would, if they need to be in an oxygen cage, we're usually referring them to go straight to emergency. You know what I'm saying? But sometimes things walk in, and we can't, we have to take them, and we're gonna do what we can. But but it is like a barrier to entry on some level for some of us, because of how complex and expensive those cages are. It's just not worth it. For, not that it's not important, but we can only have so many
by the way,
things,
that just the GP comment, right? This is too complicated for most like specialists and everything like that. And that's because, most drugs, you have a dosage if you're given orally or through a shot or something like this. Oxygen is also totally dependent on the administration method. Right. So whether we're giving it nasal or through a mask or through an oxygen cage, it all completely changes the dosage guidelines, and gases are just complicated, right? So we never expect, I've heard some horror stories of vets needing to, call grandma's oxygen shop and try to arrange some sort of system, like try to rig something together, because they have no other option.
Yeah.
Right. Yeah. And so we kind of came around for that and said, hey, we'll be your expert. We know all about this one thing, right? Respiratory distress. And, we'll really walk you through it if you want to learn, but certainly your pet owner, right? And we'll make sure they're doing everything safely. So it's very much not just like we sell you a product. Like, we are spending a lot of time on the phone with these owners and really walking them through everything.
And so do you have like, because like for veterinarians, because yeah, we understand it, but if we're not using it all the time, we're certainly not above needing, education on some of these things. And if you are above it, I'm concerned because I'm not above anything. Like I always have questions. I'm always trying to learn more. And it was something that I haven't used. I am that I will want all the information. That's how I am.
Yes. Yeah, we always want to do education with vets because it's these conversations. So we'll always, look to train vets who buy our product. But even beyond that, we do webinars and things because it's where we learn stuff too. We'll have a vet who brings a totally new use case where they stopped by us at VMX, this conference we met at, and said, I was just using this for canine working dogs in the field. Or something like that. We sell a lot of our masks to firefighters, and we didn't know that until they called in and told us they were buying it. So it's all these use cases where we learn a lot about where this can be used, but we'll show you how to use it correctly, right?
Yeah.
That's great, man.
We should actually introduce you to Barrett's O2 muzzles. Have you ever met him?
Yeah.
I was just thinking that.
Yes, I've heard of them. What he's doing is really cool as well. Yeah,
he's great.
The,
and
O2 muzzle.
Yeah. You guys should have a chat. we'll have to introduce you guys because I think that there's some overlap there, and that I know was one of the things that they found challenging was getting oxygen to those dogs in those situations in a safe way because of what you were saying about transporting large oxygen tanks. But man, this kind of solves that problem. And there's tons of working dogs that would benefit from this, and I wouldn't even have known to tell him that when we spoke to him before. So I think we need to make that introduction because I feel like you guys you have some overlap there.
Yes, exactly. Yeah, this is, I always say, like, it all goes to show like how truly deep and universal the need for oxygen is, right? It's just it's in so many places. And if you could just, I always tell people, like vets especially, imagine if oxygen was just a pill you took, where would you use it? And that kind of helps them dissociate it from that big, heavy tank. So they think of that pug during a toenail trimming, who freaks out, or that owner at home, because they're not thinking about these heavy tanks. So yeah, it's really fun space to be in because at the start it sounds really niche, but we get to deal with so many different pet owners and vets and pets. So.
Did you have a background? Like, what was your background that this was even something that was accessible to you to be able to
do? So this all started at the University of Pittsburgh, and I was actually working on making these oxygen tanks smaller for people with respiratory disease. I'm a chemical engineer by background. And my co-founder had experience in respiratory therapy. So you can see how we kind of got together to work on that. And then it was when we met this local veterinarian who needed help transporting a pet that we really just made this kind of as a favor, right? As a, yes, we can do this. Let's check it out. And we didn't really realize how big the need was. So, these oxygen concentrators for people have come a long way, but that didn't help a lot of pet owners getting from A to B or using it in their home. So we really found we can make a difference in the pet owner space, and it's been even bigger than we initially thought. So now we're 100% veterinary.
That's really cool.
Yeah, I honestly, have you seen any hospitals convert entirely from the old oxygen tanks to the oxygen converters? Because I wonder if that's a thing. Because whenever we run out of oxygen in the hospital, or we're running close to it, on a holiday or something like that, there's more times I'd like to mention on air. So I was curious, but if you had oxygen converters a backup, even as a backup, but you were would have people use it as a full-time system? I'm curious.
Yeah, mostly. Actually, it tends to be the reverse, where they'll just use that because it's essentially free oxygen that you just generate. And then you have one tank in the back in case the power goes out or something like that, right? So that's typically what people do. And we'll have GPs where, they might get we can actually power your anesthesia system through an oxygen concentrator.
I was literally just going to ask that. I was like, does that work together?
Yes. So most new ones, that's the preferred method. Is to use that. So a lot of our GPs is what they'll do is, they'll have an anesthesia system with this concentrator. Maybe they'll get one of our cages that they can, pop up when they have a pet that comes through the door. But other than that, they'll have a few kits on hand, because most of the time when they're administering this oxygen, it's for 5 to 10 minutes before they refer or while they're moving them. So we found that like our one GP always says she just like keeps a canister like in her coat pocket. And that is literally how easy and lightweight it is, you know. Weighs less than your phone is what I tend to say.
Wow.
Well,
yeah.
I had to the hospital afterwards. We'd be like, hey guys, got to fix.
And that's why we do the show.
Yeah. I know, you just gotta educate one veterinarian at a time. Hopefully this will go a lot faster to a whole bunch of people.
Yep.
I think it's pretty incredible what you guys are doing. And if they want to learn more information about all the things, what's a good place for them to find?
Yeah, it's pawprintoxygen.com. And I'd like to think if you just Googled oxygen for dogs, we'll be the first ones that show up. But yeah, we have a lot of resources for pet owners and veterinarians, both sides of that. So definitely visit. And I always say, just give us a call. You know, we are always open for people to call and learn, especially those veterinarians. So we're open there too.
Wow, I think this is really awesome. And I mean, I have myself have had people ask for this specifically. So I know there's a need. I know there's people who want this. And certainly it gives us a lot of flexibility then, because we have to refer things. So that's very cool. If anybody has questions for us, and we can always give them to you too, they can always email us at myBalto.com. See, it's been like we were away, and then we were all at a conference.
Is it podcast at myBalto.com?
Isn't it? Oh, yeah, it is. Podcast at myBalto.com. Forget what I just said.
We took a week or two off because of VMX, so
we did. I know VMX. I spoke so much. I'm amazed I even have a voice anymore after that. Were you totally hoarse after it?
Yeah, I mean, you get back to your hotel after a day at a conference. You're like, I don't want to talk to anybody, just to save your voice, right? So I'm finally recovered, but yeah, it's nonstop. But hey, that's what makes the day go way faster, huh?
Oh yeah. Yeah, and it was I think it was a nice conference. I was really happy with it. I was really happy that you came by to say hi too, because I was really excited to get to talk to you. And this is really good. I hope that you guys keep continuing doing what you're doing, because I think it's really great what you're doing.
Well, thank you. I really appreciate you guys having me on here. We'll take every opportunity to learn and talk to our vets. So thank you guys.
Absolutely, and we really appreciate you coming. Thank you so much for joining us today. This has been the Pause It Podcast. Thanks everyone for listening.